Most men over 50 are focused on what to avoid for prostate health: less red meat, less sugar, less late nights. But almost nobody asks a more powerful question: what is the one simple food I can add that actually supports my prostate as I age? Because prostate health doesn't usually collapse overnight. It declines slowly, quietly, often starting in your 40s, accelerating in your 50s, and showing up as symptoms you might ignore at first. Waking up at night to urinate a weaker stream, that feeling that your bladder never fully empties, these are not just inconveniences, they are signals. And today I want to talk about one nut that men over 50 should strongly consider including in their routine, not because it cures anything, not because it replaces medical care, but because research consistently links it to better prostate support, reduced inflammation, and healthier hormone balance over time. Before I tell you which nut it is, let me explain why food matters so much for the prostate in the first place. The prostate is highly sensitive to inflammation. As men age, low-grade chronic inflammation becomes more common. This inflammation is influenced by diet, weight, insulin levels, and even gut health. When inflammation increases, prostate tissue can respond by swelling, becoming more reactive, and more prone to symptoms associated with benign prostatic hyperplasia, or BPH. Now here's the important part. Certain nutrients have been shown to help calm inflammatory pathways, support cellular repair, and reduce oxidative stress inside prostate tissue. And one nut happens to deliver several of these nutrients in a very concentrated, bioavailable form. That nut is the walnut. Walnuts are not just a snack. They are one of the most studied nuts in relation to male health. They contain a unique combination of omega-3 fatty acids, polyphenols, antioxidants, and plant compounds that interact with the body in ways that are particularly relevant for aging men. Let's start with omega-3s. Walnuts are one of the best plant sources of alpha-linolenic acid, a type of omega-3 fat. Omega-3s are well known for their anti-inflammatory properties. Inflammation plays a key role in prostate enlargement and urinary symptoms. Diets higher in omega-3s are associated with improved inflammatory markers and better vascular health, which also affects blood flow to pelvic organs. Better blood flow matters more than most men realize. The prostate relies on a healthy microcirculation to maintain normal tissue function. When blood flow is compromised, healing slows, inflammation persists, and symptoms can worsen. Now let's talk about antioxidants. Walnuts are rich in polyphenols, including L-arginines. These compounds help neutralize free radicals, which are unstable molecules that can damage cells and DNA over time. Oxidative stress has been linked to prostate tissue changes associated with aging. Reducing oxidative stress is not about preventing disease overnight. It's about slowing down harmful processes that accumulate year after year. Another important factor is hormone balance. As men age, testosterone levels gradually decline, while estrogen activity can become relatively higher. This imbalance is believed to contribute to prostate growth and sensitivity. Walnuts contain plant compounds that may help support healthier hormone metabolism by influencing how hormones are processed and cleared from the body. This does not mean walnuts increase testosterone. That is a common myth. Instead, they may help support a more balanced internal environment, which is exactly what the prostate needs. There is also the issue of insulin and blood sugar. Higher insulin levels are associated with increased inflammation and prostate growth. Walnuts have a very low glycemic impact. They help stabilize blood sugar, especially when eaten with meals or as a replacement for refined carbohydrates. Stable blood sugar equals lower inflammatory signaling throughout the body. Now here's something most men don't expect. Gut health plays a role in prostate health. The fiber and polyphenols in walnuts support beneficial gut bacteria. These bacteria produce compounds that help regulate inflammation and immune responses. A healthier gut environment indirectly supports prostate tissue by reducing systemic inflammation. So when we talk about eating one nut for prostate health, we are not talking about magic. We are talking about multiple small biological effects adding up over time. Now let's answer the practical question: how much walnut should a man over 50 eat? You do not need a large amount. In fact, consistency matters more than quantity. About one small handful per day, roughly 5 to 7 walnut halves, is enough to provide meaningful nutritional support without excessive calories. Timing also matters. Eating walnuts earlier in the day or with meals is often better than late at night. Some men notice less nighttime urination when they avoid heavy fats close to bedtime, so consider adding walnuts to breakfast, lunch, or an afternoon snack. What about roasting or raw? Raw or lightly toasted walnuts are best. Avoid heavily roasted or sugar-coated versions. Added sugars and damaged fats cancel out many of the benefits we're talking about. Now, an important clarification: walnuts do not replace medication, they do not shrink the prostate overnight, they do not cure BPH or prostate cancer. Anyone telling you that is oversimplifying a complex organ and misleading you. What walnuts can do is support the conditions under which your prostate functions better over time. Think of it like this: if inflammation, oxidative stress, poor circulation, and hormone imbalance are pushing your prostate in the wrong direction, walnuts gently push back, and that push, repeated daily, matters. Let's also talk about who should be cautious. If you have a nut allergy, obviously avoid walnuts. If you are on blood thinning medication, large amounts of omega-3s may require discussion with your doctor, though normal dietary amounts are generally safe. And if you have digestive issues, start small and observe how your body responds. One more thing men often ask: can walnuts increase PSA? There is no strong evidence that normal dietary walnut intake increases PSA levels. PSA can fluctuate for many reasons, including inflammation, infection, and recent activity. Always interpret PSA results with your healthcare provider. Now here's where most men make a mistake. They eat well for a week, then stop. Prostate health is slow, improvements are subtle. Benefits accumulate quietly. This is not about feeling something dramatic. It's about fewer nighttime bathroom trips over months, not days. It's about maintaining urinary comfort into your 60s and 70 seconds. Walnuts are not exciting, they are not trendy, and that's exactly why they work. Simple foods, eaten consistently, often, have the biggest long-term impact. If you're already eating walnuts, that's great. If you're not, consider adding them slowly. Replace a processed snack. Sprinkle them on oatmeal, add them to a salad. Blend a small amount into a smoothie. And remember, walnuts work best as part of a bigger picture: staying active, maintaining a healthy weight, managing stress, getting regular checkups. No single food replaces those fundamentals. But if you ask me, as a medical professional focused on men's urinary and prostate health, to name one nut men over 50 should eat regularly, walnuts would be high on that list, not because they promise miracles, but because they quietly support the biology your prostate depends on. If this information was helpful, consider sharing it with someone who might benefit. And if you want more evidence-based, practical guidance on prostate health, aging, and men's wellness, make sure you stay connected. Your future self will thank you for the small decisions you make today.